Hello, and welcome to another episode of Skin Deep, Wellness Chronicles, where we take a deeper dive into skin health and wellness. I'm your host, Dr. LaKimerly, a board-certified dermatologist and Mohs Micrographic Surgeon. Today, we'll be tackling a topic that affects millions of people every year, skin cancer. We'll also talk about Mohs Surgery, which is a specialized procedure I perform for certain types of skin cancer. It's an incredibly precise and effective method, and I'm excited to share why it's considered the gold standard for treatment. Skin cancer is the most common form of cancer globally. There are three main types: basal cell, squamous cell, and melanoma. Basal cell carcinoma is the most common and often presents as a pearly bump on sun-exposed skin like on the face or the neck. Squamous cell carcinoma can appear as a red scaly patch or a sore that won't heal. Then we have melanoma, the most dangerous form of skin cancer, which can look like an irregular mole or a dark spot. The good news is that if caught early, many skin cancers can be treated and even cured effectively, and that brings up the importance of regular skin exams. I can't stress enough the value of early detection, especially when it comes to melanoma, which has more risk of metastasizing or moving around in the body. The role of a Mohs surgeon. So, what happens if you're diagnosed with skin cancer? Well, for certain types of skin cancer, especially basal cell or squamous cell, Mohs surgery is one of the most effective treatments. Now you might be wondering, what exactly is Mohs surgery? Mohs surgery is a highly specialized procedure designed to remove skin cancer layer by layer. Unlike traditional excisions, which remove a wider area of skin around the cancer, Mohs surgery targets only the cancer cells, and we examine each layer under a microscope during the surgical procedure. That's right. In the middle of the procedure, I stop, have a slide made, and look at that slide to make sure that all of the cancer is gone. That allows me to remove as little as possible of normal, healthy skin. This method has an incredibly high cure rate, up to 99% for certain types of cancers treated for the first time. It's particularly useful for cancers located in cosmetically sensitive areas like the face. So, in particular, around the eyes, the nose, the ears. Those are areas where we like to do what's called tissue sparing, meaning keeping the surgical excision as small as possible for obvious reasons. We also use Mohs surgery. We also use Mohs surgery on the backs of the hands and the groin, other areas where we want to try to keep the scar, or not even the scar, just the excision as small as possible. On the feet is another area. Even on the scalp, it can be important. What to expect on your day of surgery is what many people are curious about. So before we get to that surgical day, you've usually had a biopsy. I have reviewed the pathology report. We've had a consultation where I've explained what I'm about to say to you today. With the surgery day, you are triaged by my assistant, which means they review everything that we've talked about previously. They want to check on your allergies, make sure there are no medication changes, understand and be aware if you have a pacemaker, or if you're on blood thinners, for example. That would all be discussed on that day, and then they review it again with me on what's called a surgical timeout. After that, what I do is I clean the area. Then there's a little pinch with my fingers and a little pokey part with the needle to make sure it's all asleep. Once the area is entirely numb, I take my first layer, which means I will sometimes correct or in some way outline the suspicious area that looks to be involved with the known cancer. And then I outline it and remove it and take it to the lab for inking, which is where I make this little clock-like quadrants and take it to the histotech who makes this first slide. And that can take some time, as you would imagine. So overall, the Mohs procedure is one where you're in the office for several hours. And that's normally something that we advise for people not to schedule anything else on that day. With the specialized skills of the histotech, it's nice if we can schedule several of the same types of patients. So usually when I'm doing Mohs surgery, we'll have anywhere from 5 to 10 patients in the office that morning. And so once each slide is, while each slide rather is being prepared, I'm usually taking a layer from another patient, and we kind of alternate back and forth, reading the pathology, removing the skin cancer, and then putting stitches in as we can, or repairing. During the procedure and afterwards, even, for the most part, patients are fairly comfortable. It's really interesting what our bodies can do and how they can heal. It's important to note this is an outpatient procedure. People go home the same day after the surgery, and there may be only slight discomfort, but with good post-op care, everyone does really well for the most part. Of course, prevention is always better than treatment. Skin cancer is largely preventable. The most important, or most effective way rather, to lower your risk is by protecting your skin from UV radiation. That means wearing your SPF 30 or higher mineral-based sunscreen is what I prefer and recommend every day, even on cloudy days, even as we are moving into the fall. It's important to protect from the sun with clothing and hats as well, because there's always direct sunlight year-round, and reflective light can happen on the beach in the summer, on the lake in the fall, and in the snow even. We have reflective UV that we need to protect from. And please don't go to tanning beds. Please. Remember, it's essential to examine your skin regularly and report any changes, whether it's a new spot, an area that doesn't heal, a mole that's changing in size, shape, or color. Early detection can be life-saving. So, to wrap up today's episode, skin cancer is common, but it's also treatable, especially when detected early. And for many patients, Mohs Micrographic Surgery offers the best chance at removing the cancer while preserving as much healthy tissue as possible. If you haven't had a skin check recently, now's a great time to make an appointment with a board-certified dermatologist. Regular skin exams could make all of the difference. Thank you for tuning in to Skin Deep Wellness Chronicles. I'm Dr. LaKimerly, reminding you to stay sun safe, stay vigilant, and stay proactive about your skin health. Until next time, be well, stay well.